My name is Dr. Ntshonga Taylor. I'm a medical officer currently working in Letsola Thebe Memorial Hospital in Maun, Botswana. So I did a course that was provided by South Wales University in the UK, fully sponsored by Merck Foundation. This was an MSc in Sexual and Reproductive Health. I think this was a very informative course. For starters, it was like an online mode of delivery. So we had a chance to, and it was like self-directed in a way, because we would have questions that we needed to address, and then we'll go research about those questions, and then we'll have a discussion. The tutors that were with Merck, that were with the South Wales University, they were quite informative, they were quite friendly, they were very patient, and I think that allowed us to actually engage more with our work. I work in maternity, mostly in gynae ward, so which means I see patients with miscarriages. I see patients that have conditions like PCOS, endometriosis, and all that. So before this course, it was very hard to manage this kind of patients, especially patients with infertility, patients that are presenting with recurrent miscarriages. So me going through this course enabled me to be comfortable, enabled me to gain skills and knowledge in managing this sort of patients. And most of the time, like before, I would just see these patients were presenting with recurrent miscarriages, and then I would just after managing maybe the miscarriage, then I will just refer to a specialist. But after the course, I was in a position to actually attend to them, to investigate them, and where possible manage before I can refer to a gynecologist. Currently, we have only one gynecologist in the district, and Ngamidi HMT, like our catchment area, has about 22 villages, and it serves around 120,000 people. So you could imagine just having one specialist for this many patients. Some of the patients, they even come from like areas as far as like more than 600 kilometers away to come and to be seen by this specialist. And the fact that you know, when these patients are admitted, I could be able to manage them. I could be able to attend to them. I believe that helped a lot. And one of the things also is running the gynae clinic. Usually our specialist is the one who runs our gynae clinic and our high-risk obstetric clinic. And in his absence, ever since completing this course, I'm in a position to manage some of these conditions and help these patients out. And just right now, when you book a patient in our gynae clinic, they will be seen on around July, in July 2025. That's like almost 2 years away. So the fact that some of these clients I'm able to attend to them in the ward and also help out in the clinic, I think it removes some of this burden. And you could imagine most of the infertility patients, they can even present later on, like around 36 years, 38 years. So if they have to wait another 2 years for them to be seen, by the time they're like 40, and it's even harder for them to be managed. It's even harder for them to conceive. So I think just this course has helped me tremendously in helping my patients, and you know, taking at least some of the burden that our one gynecologist has in this area. And then that was just the first part of the course, and then the second part was a research project that was done in, like you would choose your own topic and then you research on that topic. So I did a systematic review on unsafe abortions, looking at where countries can, especially developing countries, can focus resources in order to reduce the mortalities and morbidities that come with these procedures. So from this research, a few things stood out to me. The fact that, almost 97% of these procedures happen in developing countries, and there's a lot of economical burden that comes with managing complications of these procedures. There are millions in US dollars that countries spend in order to try to manage complications of these procedures. So I was just looking at what are some of the initiatives that are cost effective that countries can do in order to try to reduce these mobilities and mortalities. For the longest times, there are things that we have been doing, even as Botswana. If I can take Botswana as an example, there are things that we have been doing to try to reduce this burden, or the burden that comes with this unsafe procedures. So when I was doing my research, I found out that there are things like harm reduction services where women are educated and are given information upon just realizing that they are pregnant. They are given information on the options that are available to them, or even safer methods of terminating pregnancies. Sometimes even for those that are willing, you can tell them about options like adoption once the baby is born. And I find that in Botswana we don't really engage in those kind of initiatives. And we found that women that go through these harm reduction services in countries that are actually doing them, they even have like less than 1% of complications. Things like the use of aspiration, vacuum aspiration, like MVA, manual vacuum aspiration. For the longest time, it has been shown to be safer. It has been shown to have less complication, to be more cost effective. But in Botswana, for example, we continue to use dilatation and curettage, which carries more complications, more cost, and all the like. So these are some of the initiatives that when I was going through the studies, I managed to find out. I believe I've had a few cases that personally I've managed successfully that would have otherwise been challenging for me if I hadn't taken the course. For example, patients that present with endometriosis, I think in our settings, for starters, it's very quite hard or challenging to diagnose them. But ever since the course and the pointers that I got, it has become easier for me to diagnose and also to manage them. They present with a lot of pain, and I find that they'll spend just a few days in the ward, and we are able to get on top of the pain. Patients that come with PCOS also, it's much easier. Using what I've learned is much easier nowadays to diagnose and to manage. And also the use of drugs like clomiphene that can help even in initiating or helping with ovulation so that they can conceive. It has become easier for me to prescribe those medication and help them out. So I've said I've had a few cases where they would have otherwise been challenging for me, but now I'm kind of on top of them. I think the course is really helpful. It's really helpful. Anybody with interest in like obs and gynae, I would recommend anybody who works in maternity. It's really a wonderful course to go through. So I'm most likely referring colleagues to come and do the course. I don't even have words for Merck Foundation. It's really been a very interesting journey with them. I've learned a lot from them. I've learned a lot from the course. The course has tremendously helped myself, my professional development, and also helped my patients. So I can never thank them enough. So thank you very much, Merck Foundation, for what you're doing.